Hello and welcome to this session on the medical debate, where we will be talking about pain, receptors, and management of this pain. So what exactly is pain? We're going to be talking about some of the evolutionary benefits of having pain, advantages of pain in evolution and survival, and the uses of pain in the daily human body. In the picture you can see on the right, you can actually see that this is sort of how pain is felt. So you've got a presynaptic neuron and a postsynaptic neuron, and you've got the neurotransmitter going across the synapse. We'll be talking about this in more detail in this presentation, and we will be explaining the reflex arc soon. So what exactly is pain? So pain is obviously the sensation when you feel, which is abnormal. It's not something you should be feeling all the time. And it signals when something is wrong within the body. There are different kinds of pain. So there's throbbing, pulsing, and I'm sure everyone is aware of this. Pain can be localized, so in one specific area, or it could be a general radiating pain. So pain could be traveling from one area to another, and it's in different severities. Pain tells us when something is wrong, for example, a broken bone or a torn muscle or some immunological factor. Pain is an excellent signal to tell us what is wrong and what the general region for this pain is and where the problem is and what kind of problem has occurred. It also acts as a preventative measure. So just by learning and adaptation, if you know that you feel pain by doing something, you're less prone to do something in the future, which increases your chance for survival. In this case, pain is very advantageous. And there are a few mechanisms behind feeling bodily pain, and we will go through these as well. So before you saw the image of the synapses, you saw the reflex arc. We'll be talking about synapses, neurotransmitter, endocrine or hormone responses, CNS, which is the central nervous system, and the reflex arc, as I mentioned. So this is just a quick overview. Our skin and organs are lined with many receptors which pick up subtle changes in environment and responds to different stimuli. So receptors are everywhere. There are many different kinds of receptors, and the pain receptors are called nociceptors. And they pick up on potentially harmful sensations, particularly sensations of touch, on the different organs where the receptors are. And this leads to a response by the reflex arc. Now that I've given you a general overview of the reflex arc, we're going to actually go through it. So in the reflex arc, it's how reflexes work. That's the mechanism for how something happens, an involuntary action happens, and these are called reflexes. So in the reflex arc, a change in stimuli is picked up on by the sensory or the afferent neurons at a receptor. So as we mentioned, a receptor is the thing that senses the change. So in the picture on the right, there might be a receptor in the person's finger, which is touching the flame at the top of the candle, as you can see in the image here, and the bottom right where it says finger receiver. Then the sensory neuron would be the neuron that takes this received sensation and go to the central nervous system with this received sensation. So in this one, it's the blue neuron. I think the I think the arrows might be going the wrong way in this diagram, but just it's the blue neuron, so it senses the change and it takes it to the central nervous system, and then they are relayed to the CNS. The CNS is the central nervous system where the spine is, and the spine meets your head, where your spinal cord is. And after this, it is computed. So this received signal is computed by the spinal cord and by your gray matter and your brain to see exactly what this kind of pain is and what it's telling us. Then the CNS relays an order via a relay neuron or an interneuron, which is inside the spinal cord, and then sets up a new electrical impulse in your motor neuron, which makes a muscle contract or makes you move to make you get out of the way of this potentially dangerous change. This muscle which changes is called an effector, as you can see where it says muscle. So now let's talk about this. So we're going to be talking about the thalamus, and we're going to be talking about more about synapses and how this passes through. So at synapses, so as you can see in this image, this is where this sort of picture shape is called a neuron, and the gap between two neurons is called a synapse, across which Neurotransmitter
And
chemical
at the
diffusers.
synapses, you have a junction between the two of them. And this is this gap in between where it says postsynaptic neuron and presynaptic neuron. So the synapse is the gap. These are neurons, and the synapse is the actual gap in between them. In between the two neurons, you've got the synapse, and in the synapse, you've got chemical, which diffuses, called neurotransmitter. When an electrical impulse comes from one synapse, so in this picture, as you can see the presynaptic neuron, there'll be an electrical impulse. It reaches the end of this neuron, and then this electrical impulse causes the neurotransmitter to diffuse across the synapse and be received into receptors on the postsynaptic neuron. This means that the electrical signal is reset up in the postsynaptic neuron and is relayed to wherever it needs to go. The brain then coordinates, as we said, a immunological response if necessary, or if needed, a natural painkiller response, which is set up by endorphins. And when at the spinal cord, the chemical transmitters also get to the thalamus in the brain, which coordinates an appropriate response. So let's talk about painkillers. Painkillers work in different ways. There are different kinds of painkillers, and there is a legal right of certain patients to painkillers. One type of painkiller is an NSAID, which blocks COX enzymes. These types of enzymes are used in the production of prostaglandins. Prostaglandins are used in the simulation of pain in sites of injury. An NSAID might include aspirin or ibuprofen, for example. Opioids work by binding to opioid receptors in the body. This actually increases your tolerance for pain. And all surgical patients have a legal right to painkillers after their surgery. If you've done the UCAT, for example, that is a common situational judgment question where they ask about patients being allowed painkillers in certain dosages, and it's a legal right for surgical patients to be allowed painkillers. Now, I would like you to have a think for 3 minutes. We'll give you a 3-minute timer up here on the board about what happens if you can't feel pain. Using all the information given to you in today's presentation, I want you to think about this and decide what are the disadvantages of not feeling pain. After the 3 minutes, I will reveal some answers, and then that will conclude our presentation. So your 3 minutes start now.
Okay, so the main disadvantage of not being able to feel pain is that this actually leads to you not being able to tell whether there's an injury. If there, for example, if you are in a football field and you've been playing football and you've accidentally been injured, you will feel pain and you will immediately know that there's something wrong, which will mean that you divert your attention to that and make sure that the issue is resolved. However, if you cannot feel pain, then you cannot divert attention to this, and the situation might actually get worse if you continue to use that foot to play and continue to use the muscles which have been sprained, torn, or very, in worst case scenario, very badly damaged. So it's very important that pain is there to tell us exactly when something is wrong. The other thing is, if you don't have pain, then you will not have this preventative measure we talked about. If you can't tell if something is wrong because it causes you pain, then you might be likely to redo that action, which will cause you to have more pain and more damage in the future. Thank you very much for listening to today's presentation on pain management and receptors and exactly how pain works in our body. If you have any questions, please feel free to ask us on themedicaldebate@gmail.com or DM us on our Instagram @themedicaldebate. Please also subscribe to our YouTube channel where all of our videos are posted, and that is The Medical Debate. And follow us on Instagram to stay up to date on future sessions and guest speakers. Thank you very much for listening. If you have any questions, please feel free to comment on the video as well. And see you guys for the next one.